joint, muscles, rheumatology is something that I don't know that is addressed as much in functional medicine as it should be or could be. People are in pain. People are struggling with pain. And a lot of times they're just given steroids, they're just given drugs. So we're here today to talk about a different solution. We're here with Dr. Isabelle Amigues. She's a rheumatologist and she's based in Denver, Colorado. She honed her expertise by studying Paris as well as Columbia University in New York. At age 40, she was diagnosed with stage 4 metastatic breast cancer. A timely meeting with a non traditionally trained practitioner taught her a different approach to disease, and she experienced the power of meditation, visualization, energy healing, and love. And her journey through cancer inspired her to learn more about these alternative techniques. And now she blends Western medicine and Eastern techniques into her practice at Unabridged MD. Welcome today. I'm so excited to have this conversation with you today.
And thank you so much for having me, Dr. Ritamarie. Such a pleasure.
You are so welcome. And it's a breath of fresh air when we can speak with medical doctors who have, like I said, seen the light that what you learned in medical school was not the only solution to health problems, right? Like in medical school, you learned a lot about disease diagnosis, differential diagnosis, and then, of course, drug approaches or surgical approaches to it. And in a more Eastern philosophy, a more integrated philosophy, there's a lot more tools in your toolbox, right? And I wanted to talk to you more about that. I know that you use a combination of the mind body stuff, but you also use a dietary approach that I want to talk about as well that you found so useful. So, share with us a little bit about how you work with people when
Mhm.
they're coming to you as a rheumatologist. How do you
Mhm.
work with people who are coming in with whatever it might be, rheumatoid arthritis or a variety of other autoimmune diseases and things that
Yeah.
result in pain and inflammation?
Yeah. So, first of all, thank you so much. I really like to share this new perspective because the goal is to prevent anyone from having to go through what I have been going through. And also, so that's prevention. I'm big on prevention. And the second one is to help patients to get rid of whatever conditions they have, but so that they are better after. I was sharing this yesterday with one of my patients, and she has rheumatoid arthritis that's pretty severe. But most importantly, I told her, yeah, we can get you to remission. Western medicine is very powerful. And so, yeah, I fully agree with how you presented my approach, which is I think that there is more to the Western world of medicine, and nutrition is definitely a huge part of this more. And I think it's important to realize that to me, we combine them depending on how advanced a condition may be. And advanced may not necessarily mean in time. It might mean intensity. And so I was telling this yesterday to this patient. I was saying, the truth is that every time we have a condition, we can see something positive out of it. And the goal is to get you to remission and at the same time not lose the opportunity of learning what there is to learn from that experience, right? Because and you mentioned steroids. Steroids is not great because you don't want to have it long term. But the truth is that a rheumatologist can put anyone in remission at this point. It's different than cure. It's remission is no more symptoms, and no more inflammation in the body. I think it's very powerful. Like our Western medicine is very powerful. The issue is that if you don't change what's at the root cause of
Bingo.
causing those issues, you may actually just develop something else or you're going to flare again and so on. And so I'm on this belief that when something happens to us, we have to stop and look and learn. And when you mentioned my story saying that I had met a non-traditional practitioner,
Yeah.
she was I met her, I'm going to call her a talk therapist. She's not a talk therapist. But this is exactly what it did. And what she told me was, don't see the cancer as an enemy, but see it as a friend who's here to teach you something. And that was a big light bulb moment of, hold on, I've been looking at diseases this whole time as something that I need to get rid of for my patients. What
Mhm.
if we could learn from them? And if you learn from someone and if you're not in a fighting mode, your chances of having peace are so much better, right?
I want to stop you there because peace, right? We
Yeah.
talk a lot in medicine about the warrior model, right? Fighting disease, battling, winning the battle. And peace is something we all really strive for. I wish we had that in the whole, whole world at large,
Yeah.
more of that, right? So it's shifting perspective
Yes.
of creating peace in the body, not creating a battlefield.
That's exactly it. I actually think I really like how you put it. And it's funny because I had a TEDx talk where I say exactly this, which is like the number of time you hear like, oh, he's battling cancer, he's battling depression, he lost his war on cancer, and you're like, wait, hold on, like it's not a war. Like at the end of the day, the cancer cells, like they were mine. I don't want them. I think I've done the work, and yet they were mine. They had my DNA, and so fighting would have meant that I was fighting my own body when really what I wanted was to heal my body. And so then let's go into the nutrition part. So first, I don't like the word diet because I think that especially as a woman, I think I started my first diet when I was like 12 and I was super thin. Like it's ridiculous, right? But we live in a world where it was like all diet everywhere, diet this, diet that. It's interesting. I'm French, cannot hide it. And in the US, there's so many diet, right? Gluten free, dairy free, paleo, like
Yeah.
the carnivore, this and that,
Keto,
and that. And
yeah,
I was like, I
exactly.
couldn't understand at first. I was like, wait, what's going on? Like coming from France where there's just one diet. Like there's very rarely a vegetarian, but really in general, it's one diet. And so I was like, this is so weird. Like I'm not used to it. And so the reason I don't like diet is that I think it tells us restriction. And I don't think that that's the way to live life. Like our goal, and especially my goal as a rheumatologist, is for my patients to live a full life without even thinking of their condition, right? And the only time they're thinking of it is if they have to take a medication. Okay, fine, not a big deal. But that's it, right? That they are able to skydive if they want, scuba dive if they want, golf, play tennis, and so on. And so then if I tell them, "Oh, you need to diet," like, "You need a diet," I'm like, "No, that's not what it is." What it is that everything you're putting through your mouth can be nutritious or can be pro-inflammatory, right? It's funny, I had this, and it's very funny. Like, if you think about it, diet should be very easy to understand, but it's like that's when you realize we don't really learn much about it in medicine. And I've done 17 years of training, and I can tell you I've had very little information on diet, but like nutrition, right? What's really interesting is that very often, if you're talking about diet, you're talking about restriction. So people have this idea that I cannot eat this, I cannot eat that. This is not good for me. This is not good for my right. So I'm not going to take this, and I'm not going to take that. The issue is that then you restrict yourself instead of looking at what you can eat, and that is actually nutritious. So when I got diagnosed, I was actually so I got diagnosed right before a trip to France for my midlife crisis. I was like, I'm done. I'm leaving the kids home, and I'm going back to my roots. And it was actually the best thing that could ever happen to me because I got my diagnosis surrounded by my friends and my family in France. And French people are funny because they give you, they make fun of you. So it was like very fun. It was just like, oh yeah, like Isa, you're fine. You're showing us how a midlife crisis is. You're dealing with cancer. Like instead of being in the pity way, they were like just making fun of me in a very kind and loving way of you're fine. Like you're gonna show us how it's done. And it's very funny. At that moment, one of my friends started telling me about diet and like so nutrition. She was like, "What is you eat a lot of processed food." And it's true because I was eating, easy made, already made food, right? So I was like, okay, but whatever. Like we didn't learn much about it in medicine, so it wasn't really what was on top of my mind. Then I take my flight back, and I stayed there 4 days. I take my flight back, and when you have it's funny. This is the moment where you're very vulnerable and you meet really important people in your life. So this was on my mind, midlife crisis, going back to my midlife crisis, and now dealing with having to deal with this cancer. And I meet a steward, it's a 10 hours flight back, so you have the time to meet people. So I meet a steward and we talk, and he tells me that his mom has brain cancer, and that he's big on nutrition. And I'm like, you're the second person who's telling me about diet, about nutrition, and yet I don't want to live restricted. And he's like, no, it's about what you can eat. Have you looked at the food shop and looked at all the things that you don't know? And like look at the project section and see all the things that you may not even know exist.
Mm.
And I was like, okay. So then that was like the second time. And then literally the next day. So this is like in 2 days difference. And then over one day, there's another person I saw, a Qigong practitioner. And she told me again, she's like, you need to change your diet. And I was like, okay, that's it. Like, this is the third person telling me in less than 3 days. I need to change my diet, right? Like you believe or you don't believe, but at one point you're like 3% from totally different area
Mhm.
of my life are telling me to change my nutrition. And that's when I actually changed my nutrition. And it's big. I think that we don't realize how huge that is. And I'm going to just share my own realization that literally I changed my diet. So I started like eating veggies, and I would go to the produce section. And every week I would be like, okay, I'm trying something new. So I tried turnip, I tried sunchoke, and I don't like celery still, but there's a bunch of like things, or kale. I think I had not tried really kale then.
Mm.
And right, so you're going to the product section, and you're like, I'm going to try things. I'm going to try new things. And it's fascinating. I was undergoing chemo. I was, dealing with stage 4. That's like the scariest one. Metastasis to other organs. That's really scary. Yet, if you ask my friends, they will tell you that I looked better than I had ever looked before. And I really think the reason for that is the diet, like the nutrition, because I was eating all the things that were good for my body. It's clearly
Mm.
not the chemo that made me feel better.
Right,
Yes.
right.
So let's be clear on this, right? And so I think it's a combination of uh, doing what you need to do with the Western medicine world, and then taking what other things are so important, right? Mental health, being surrounded with love, and nutrition, and for like just mentioning some of them, right? And the nutrition is a huge part. And so in rheumatology, we know that there are things that are pro-inflammatory, and we know there are things that are anti-inflammatory. And because you're dealing with a lot of inflammation in the rheumatology word, so when you have rheumatoid arthritis, psoriatic arthritis, and so on, you're trying to decrease that inflammation. And it is really important that whatever you're putting through your body is just as important as a medication. And so I tell my patient not to do 100% because I think that that's too restrictive, but to aim for 80%. There are weeks where you're going to aim for 90%. Some other weeks are going to be like 75%. But overall, aim for 80% of nutritious food, if that makes sense.
Wow. So that's a big awakening, right? And 3 people in a row, coming across with it. And I don't like the word diet either, because again, it feels restrictive. I'm on a diet. Food plan, eating plan, something like that. Food choices. But I think what you're hitting at is the food part is so important. We're not saying, what herbs should I take to cure rheumatoid arthritis? What supplements, although those can be an important part of your healing process. But what we're looking at is how are you feeding the body? And if we're just putting ultra processed foods that doesn't really have any real ingredients, then how does the body know how to rebuild? How does the body know how to control that inflammation, right? And again, which you mentioned in your process was it's not really getting at the root cause. And yes, there are times we need medication to subside the symptoms, but when you get the symptoms under control, if you haven't addressed the root causes,
Right.
then it's just going to come back, and it may not come back in the same place. It may come back elsewhere, which we
Yes.
see a lot in cancer. We see that a lot in autoimmune disease. Another autoimmune disease pops up, even though the symptoms of whatever it is, the rheumatoid arthritis or whatever, seem to be under control. You haven't really put the autoimmune process in remission. You've just pulled the battery out of the smoke detector that's telling you that there's a problem, and it pops out elsewhere. And so I like the idea of not making it feel restrictive, like what you can't have. And I always start with what can you have and how can we add a lot more of that, because then that's gonna displace the Fritos, the Cheetos, and the other junk stuff that you might be having, because there's just no room. There's just so much you can eat. So if you set a goal for this is how much good, whole, fresh food we're going to eat in a day, there's not a whole lot of room left for the other stuff. So tell me a little bit more about your approach. Like what kind of conditions do people come in to see you with,
Mhm.
and where do you start? Like, because you mentioned a lot of tools, right? You mentioned the diet, the food. You mentioned the mindset. You mentioned the energy. So where does it start?
I think you start where the patient starts. And I think we have to listen to our patients. They tell us where they want to start. And then it's about adding a little bit to it. The most important thing is to be kind to ourselves.
Mm.
And it's really interesting, this relationship we have with food, because in one hand we feel guilty about maybe eating the Cheetos and all this, and it's not about that. It's the question of, do you really want the Cheetos? Like, is this really one time where you really want the Cheetos, or are you just governed by this need for, high sugar, high salt that you're so used to, and like the bag is open in front of you? It's really hard. Like, I always think, if I'm gonna eat one chips, I know I will not start and I will not stop. So I have to, like, basically give everything away and I
Yeah.
have only like the one chips that left, right? But yeah, I think we start with kindness. Kindness, understanding, realizing that the world is made for us to eat unhealthy food, because that's how they make money. I mean, it's all about
Right.
money, in the food world, right? Like, and the more we eat Cheetos, the more the Cheetos company makes money, right?
Right.
And I think it's about, understanding, like, what's the goal, like how can we improve our patients lives. And like, I didn't stop sugar right away because I like chocolate a lot, and that gave me a lot of happiness, right?
Mhm.
And so it depends on what the patients are coming with. Like, if I have a patient that's already having a very healthy lifestyle, then we have to work on something else. It might be stress, it might be guilt, or it's just that they really have a very inflammatory arthritis and we need to take care of that, right? There are some patients that will come and will say, yeah, I don't have a healthy relationship with food. And I think that moment where they say that, you have to say, okay, what do you mean by that? What's happening?
Mhm.
And realizing very often, it's either because their whole family, none of them eat healthy, and if they don't make the burgers and the pasta, they basically, their family is kind of not angry but almost, right? Like, if I start making kale, my kids usually are not very happy, and they know that if I'm making kids, there's not much for them. I can make pasta, but they better eat the pasta because I don't want to eat the pasta, you know. But yeah, I think that there's that. The other thing that I see often is this guilt. They're going to be really good with a diet, and then they eat something, and then they just can't stop
Yeah.
because they feel so guilty. And it's kind of like this idea of, like, let me hide the evidence that I just had a cake with a ton of sugar, or and you're like, no, like, enjoy that, enjoy it. Like, and just make sure, just enjoy it because you're at 80%. I will say, not like the food is important. I think even more important is loving ourselves and this kindness towards ourselves. And I think sometimes I feel like food is a hot topic that I don't necessarily address right away. I start talking about it and I don't necessarily address it right there. Because again, the goal is not to, to guilt our patients. Like the whole goal is for them to realize that a better life is available to them and that they are empowered and they have tools that they can use and it's not just medication. And so it depends, right? It's the stress level in their life. It's saying no, like, right? What better than a condition to say no when people are constantly asking things, right? Like, you need to do this, you need to do that. Can you take care of the grandkids? Can you take care of the kids? Can you take care, can you do the food? Can you do this? Can you do that? What a better way to say, no, my arthritis is flaring up. I can't help you right
Mm,
now. And so, right. And so then you're like, okay, hold on. Like, if I remove that, I'm removing your ability to say no. So let's work on you being healthy
mm. I
and
love
knowing
that.
how to say no, right?
I love it.
Because saying no is also saying yes to a better you, or to so much
Yes.
better for you.
Yes.
I think no is also a full sentence, and doesn't have to be explained, and there is no reason to be guilty. But it's really hard, especially as women. It's actually very interesting. I think men also, but it's my word in rheumatology. There's a lot of women, and it's especially hard for women for sure.
Yeah, well, that's a great perspective. And I think we're going to end with that because I think it's so important for us as health practitioners, not bombarding a person with what they need to do or stop doing, but also really looking more deeply as to what's going to happen if we take away their excuse for saying no, right? And teaching them how to be empowered to say no.
I wouldn't even say it's an excuse. If you actually really, because I'm so big on the word, and it's funny because I'm French, and but I think their ability to say no, because I think it's not an excuse, it's an ability.
Mm,
We can't take away their ability to say no. We have to enable them to say no without the need for this ability. And at the end of the day, my goal, how I see it, is to restore a balance in my patients so that they are feeling even better after this than they were
yes,
before this.
I
Right?
love it.
Like you're not coming back to where you were. You're actually going to a better place.
Yeah, I love it. I love it. So I appreciate your time here. I know you have a lot of things to do in a busy life and a busy practice. And I really appreciate to give our practitioners this perspective of working with people where they're at, meeting them where they're at, really understanding the reason behind their condition, right? Whether it be the root cause imbalances in their body or the mental and emotional overload that they're dealing with. And so key takeaways for me are working with people where they're at, working with their ability to say no to everything out there and say yes to themselves and their healing and their beauty and to be kind and loving to themselves, right? And to treat food as what it is. It's signals, it's a message to the body to either function well or dysfunction. Together we can transform health for ourselves and for our clients. If you enjoyed this video, like, subscribe, and check out our other videos on metabolic health and hormone balance next. I'll see you on the next video.